vehicles.
So for those of you who've chosen this section, today we're going to be going over naloxone, what it is, how to use it, and when to use it. I've invited my friend Amanda here to join in the conversation. So Amanda's never done naloxone training before. So they're kind of here to ask questions as we go along. That way, if there's something I might be missing, they might be able to ask the questions that the folks watching this video aren't able to ask as the filming's happening. So, Amanda, what do you know about naloxone?
It is something to help stop opioid overdoses.
Yes. What are opioids?
Pain pills.
Yeah.
Pain medication.
Yeah, so narcotics like morphine, codeine, heroin, Percocet, Dilaudid. We also have on the street right now fentanyl and carfentanil, which are extreme versions of an opioid, which is what causes problems because it's just so much stronger. So naloxone is a temporary reversal of an opioid overdose. And it's temporary because it works temporarily from anywhere from 20 minutes to 2 hours, but it does wear off, and depending on the amount of opioids in somebody's system, they can overdose again the second it wears off. Because we have receptors in our brain that grab onto opioids, but those receptors like naloxone more. So naloxone will go in and kick the opioids out of the system, but when it wears off, the opioids will reattach. So if you give somebody naloxone and they decide that they want to use again within an hour or so, they're not going to get high because the receptors aren't picking up on it. But when the naloxone wears off, they can overdose again. So it's definitely important to have medical intervention even after administering naloxone.
Okay.
So an opioid overdose, there's generally some key things with folks. You'll notice like dilated pupils, they might be unconscious, they'll be either not breathing or breathing in a way that sounds almost like a heavy snoring, and that can sometimes be known as agonal breathing. It's a scary noise, and so if you hear it, it's generally a key indicator that something is severely wrong. Also, you might notice some blue around the lips, and that has to do with lack of oxygen. So the first thing with naloxone to know is if you see somebody who's overdosing, you might know they've overdosed on an opioid if you see like a needle by them or even sticking out of their arm. Sometimes right now with fentanyl, if somebody uses heroin through an injection intravenously, the needle might still be in their arm. And in fact, I've also seen it where the plunger isn't even down all the way and somebody's OD'd and gotten unconscious before they can even push the plunger all the way down. So it's scary.
Yeah.
But other times people can ingest it, they can snort it. There's other methods of administration that you might not know. So the key thing is you never want to give naloxone unless somebody's unconscious.
Okay.
Because if somebody's not unconscious, they're not at the point where they need naloxone. That means they're still able to breathe, things are still happening, they can get help in other ways, or they might also just be nodding off, like an extreme high.
Okay.
So if you come across somebody who's unconscious and they have a needle in their arm, you generally know this is a case for 911 and naloxone. If you come across somebody who's unconscious and you suspect it might be from an opioid, naloxone will help. If you're wrong, it won't hurt.
Okay.
Naloxone only works for opioids. So if somebody has OD'd on a stimulant, for instance, something like methamphetamine, naloxone won't work unless it's been laced with an opioid that increases the overdose risk.
Okay.
So it would deal with the opioids, but it won't deal with the other risks. Have you ever seen a naloxone kit before?
Not opened up.
Okay, so this is the naloxone kit. On it, I have attached a CPR mask. The naloxone kits come with a mask. I just prefer this one better.
Okay.
It's a one-time use mask, and I like it because it has a little piece that goes in the mouth, so it protects somebody from aspirating vomit, and then, you know, the risks of transmission of like sharing vomit with somebody is not very pleasant. Yeah. But the other face masks are good. They still offer some protection. And then inside the kit, do you want to do the honors of opening it up? So there's lots of goodies in here.
There's instructions.
Yeah,
I like that.
there is. So we have gloves, which are really important. One of the first things you want to do is call 911.
Okay.
Because if you're by yourself, it's even harder to give naloxone. But if you're with somebody, it's still best to call 911 because the goal is to get the person breathing again, but they still need that care. And they might need more than one dose of naloxone, and each kit comes with 3. But the reality is after that, they still
Might need more.
might need more.
Okay.
And so getting an ambulance there as soon as possible is key. And then when you approach somebody, what you definitely want to do is have gloves. And as I'm putting on the gloves, what I'll generally do is I'll yell at the person.
Okay.
And the reason I do that is I want to find out if they're conscious, because they might just be sleeping, there might be something else going on. And so I'm going to yell something like, "Are you okay?"
Okay.
You know? And if I don't see a reaction, I'm going to be like, in a loud voice, I'm going to be like, "I'm coming up to you, I'm going to touch you to see if you're okay." You still won't get a response, and then you know that clearly something's wrong. And so the first point of naloxone, they use, I don't know if folks can see on the directions, but they use an acronym called SAVE ME.
Okay.
And the S stands for stimulate. And what that means is you want to find out if the person will come to consciousness with some stimuli that's not so pleasant.
Pinches.
So sternum is
Okay.
kind of right here on the chest. I'm just gonna do the video. So it's kind of right here, and you want to take your knuckles and rub hard.
Oh, okay.
If you want to try it with yourself to get a feel,
Oh,
it's
yeah.
it's not pleasant.
No.
No,
No.
it's not pleasant. It's not going to cause any harm, but it's going to hurt. And if they're in a position or you're not comfortable rubbing there, because if somebody does come conscious, they might swat you in the face the way you lean over to do it. Another one you can do is under their nose.
Okay.
So in between the upper lip and the nose, if you rub, that doesn't feel so good either. My favorite would be pinching their nail beds. So right where the nail is, you pinch down, and that hurts.
Oh, yeah, that would.
But if somebody comes swinging, your face isn't in the way. So,
Totally.
so that's a big one. So the point of this again is to, if they're passed out, but they're coming to with some painful stimuli, you know they're safe. You can kind of monitor them and see if it goes downhill from there. But oftentimes people don't respond, and that means they're completely unconscious. And so what you want to do is the A in SAVE ME stands for airway. I'm just going to do a thing like that again if folks want to pause and kind of look at that. But airway stands for, in like first aid classes, they teach you how to push the chin back, and what you're doing is you're trying to open up the airway. And then what you want to do is ventilate it. So that's the V in SAVE ME. And ventilation means that you want to give one breath every 5 seconds.
Oh, okay.
So with an opioid overdose, unlike in first aid classes, they generally say, don't worry about giving breaths, give CPR. That is the complete opposite with an opioid overdose. You do not need to worry about CPR. You definitely need to focus on giving breaths because the issue is somebody's no longer breathing.
Okay.
So
Breaths, not compressions.
yes. And if 911 is already called, even if you don't have enough naloxone or they're not waking up when you're giving it, as long as you're still giving breaths, you're keeping them alive.
Okay.
So that's the main focus. Naloxone is just a way to kind of get you there.
Now, I also know from what I've read that breaths are important because oftentimes it's brain damage that we're trying to mitigate.
Yes.
Okay.
Yes.
wanted to
So,
clarify that.
yeah, when the body goes without oxygen for a certain amount of time, it's a brain death. The brain starts dying because it's not getting the blood flow. Oftentimes when you give CPR, it pumps blood, which brings oxygen to the brain.
Okay.
However, with an opioid overdose, there's no problem with blood flow. It's that the brain can't receive the oxygen because the receptors that would then kind of understand and have a relationship with oxygen are being blocked by opioids.
Okay.
Yes. So the first thing you want to do again is stimulate, and then you want to open the airway, and then gives breaths, one breath every 5 seconds.
Okay.
And then the last letter of the word save is evaluate. So essentially, as you're doing this, you're not going to step back and pause and kind of contemplate your place in life or anything like that. What you're going to do is, as you're giving breaths, you're just essentially making sure that the person hasn't come conscious or all of those things before moving on. If they have, that's the opportunity to make sure they're in the recovery position, they're safe. So it's kind of the point before you give an naloxone injection, you just want to make sure the person's still unconscious.
Okay.
So safe, stimulate, airway, ventilate, evaluate.
Okay.
So now on to naloxone. So M in Save Me, the M stands for muscular injection. And so naloxone in the kit comes in a container, and you get 3 amps or ampules, which are 0.4 milligrams or 1 milliliter of the drug. And so if you want to even have a look at that, they come with a plastic cap. This wasn't always there, but they noticed that when they snapped open the vials, people would cut their hands without the plastic cap. So the plastic is more of a safe measure.
Okay.
And what you want to do, and it's a habit, is whenever you have naloxone, you just want to kind of swirl it. And the reason being is at the top of the cap, the liquid sits inside. And so when you snap it, you lose that liquid. So you kind of just want to give it a gentle swirl to make sure it gets to the bottom. I'm going to be honest, the first couple overdoses you respond to, yeah, it doesn't work.
No.
I know, it's tricky.
That works.
Yeah. So the first couple overdoses I know I've responded to, all this went out the window. And really, the biggest thing was give the person breaths, get naloxone in their body. However, you do want to try and get all the drug possible. And so the thing with this naloxone is it can be kind of scary to snap open because it is a glass bottle. It's not very simplistic. But right there, you might notice a little dot. I'm going to try and show that. I don't know if folks can see it. It's kind of right there. But what that is the pressure point. So you can kind of try and snap where that dot is.
Okay.
So again, I'm swirling because I let the liquid go to the top. And so what you just want to do is grab and have your thumb where that dot is and just snap. It's not fun. It's scary.
Ooh.
Yeah.
Want me to do it?
Yeah. Go for it. Oh, you did it way cleaner. And so this is naloxone, and this is what a naloxone vial looks like, and that's what it looks like when it's open. So the snapping one takes a lot of practice. I still don't like it. I still get nervous doing it, and I think I've administered naloxone at least 20 times. So it's just a matter of when your adrenaline kicks in and you've seen somebody overdose, you're gonna snap the bottle, whether you're scared to do it or not.
Totally.
So do you want to just hold this for me for a sec?
Yes.
So here's the hard part, and you're going to realize this when you're by yourself because you still have to give breaths once every 5 seconds while trying to snap the bottle, not spill it, and open the needles. So what most people do in a panic is they try and just, like a straw, shove the needle down and shoot the needle out. You can't actually do that with these needles. You risk damaging them. You have to kind of open them the way they're meant to be opened. Which is really hard. Again, there's a few times where I've had to put the naloxone on the ground while giving breaths, and I've knocked it over. And then I've had to open another one.
Yeah.
So here, what you want to do, I'll just take this one back, and if you want to open the needle, there you go, yeah. So you want to take the cap off the needle and put the needle all the way into the bottom of the vial. And draw up very slowly. So you're just pulling gently. And what's happening, if you pull too hard, you're just pulling air. So you can even stop and it will keep filling. And so generally, while this is my hand, I'll try and give another breath or two.
You want to get all of it.
Yeah,
Okay.
that's the goal. So sometimes you'll have air. If you see here, I have the stop is here and the naloxone ends there. My bottle is empty. So then you can tip up and push out the air. You don't want to push out any naloxone, so it's okay to have a little air left.
Okay.
Unlike a needle that you'd be giving intravenously, you don't want any air. When it's going intramuscularly, which means into the muscle, it can have some without damage.
Okay.
And so it's better to not get rid of the drug than it is to get rid of the air.
Okay, that makes sense.
So now what you want to do is you would give an injection into one of 3 places. My favorite is somebody's butt.
Okay.
And the reason is, no matter if somebody's sitting, lying down, or on their stomach, I can generally get a piece of their butt, and you can give the injection through close.
Okay.
So it's literally a matter of stabbing straight in at 90-degree angle. And so we can actually practice that with this. So what you're doing is you're going straight in at a 90-degree angle, and then you're pushing. And when you push, what's going to happen, these are called vanish point syringes. So if you push, what happens is the needle springs in. Yeah.
Oh, cool.
We could see Amanda's expression.
Okay, that's really Okay, that's really cool.
Yeah. So if you want to give it a try.
Okay, so 90 degree.
Yep. And push.
Push.
And you can push hard, you can push fast.
Push hard, push fast, and then at the end, just
Keep pushing.
keep pushing.
I don't think it's done it yet.
No, it didn't.
Yeah.
Here, wait. I'm gonna see.
Yep.
There.
There you go. So yeah, it's a very discernible click.
Yeah.
It doesn't always happen. And so you don't want to rely on the fact that there's not going to be a needle.
Okay.
However, 99 times out of 100, I would say it would happen.
So basically, when you take it back out, don't take it sideways because the needle might still be there.
Yes.
Okay.
But the point of vantage point, which is really helpful, is then you don't have to worry about dealing with a sharp. You can drop it on the ground and continue ventilating.
Nice.
Yes.
That's so smart.
So through this whole process, again, the M is a muscular injection. The E stands for evaluate the second time.
Okay.
And that's to know whether you're supposed to give a second dose or not. You generally want to wait a few minutes
Okay.
because it can take time to kick in. So in all this time, you're still giving breaths. And so Save Me Again stands for stimulate, airway, ventilate, evaluate. And then there's going to be a muscular injection. And then you're going to evaluate again. And so through all this, the hardest part is remembering to keep giving the person air. With that said, when medical emergency comes, an ambulance, sometimes they'll restock your Naloxone for you. So if you're like, hey, I just used all 3 amps of my Naloxone, they'll give you 3 amps of theirs. And so that can be really helpful because a lot of pharmacies will give Naloxone for free if you contact them in advance and ask. They can let you know, but it could cost up to $15 per amp.
Okay.
Generally, the kit comes free, but you're paying $15 per amp, which is $45 for a kit. So in Victoria, you can get them free from Solid, from AIDS Vancouver Island, known as AVI. I think Health Services at UVic now has them as well.
They do.
So there are ways to get them for free. It's definitely worth looking in your community if you're not in the Victoria area where that might be. I think there's also a pharmacy down on Yates that gives them right across from our place. That will give them for free as well. Yeah, so how are you feeling?
Okay, so I am going to say, as somebody whose hands do not work well,
Yes.
that wasn't hard.
Okay.
Yeah, that wasn't hard. It wasn't something that I wouldn't be able to mitigate. Even if my hands were working worse today, I'd still be able to do that.
Nice.
Okay.
That's actually really good to hear because that's something I definitely, honestly, to this day, even just now, I had a problem breaking it. And I think it's because the first time I did it, I got stitches.
Ah.
They didn't have the plastic caps on when I first started.
Okay. That's nice.
And so the plastic caps definitely help.
No, that was the release of the needle as well helps. I've used injectable needles before, so that wasn't anything that I'm unfamiliar with, but that feature is phenomenal and makes the idea of removing the needle that much easier.
Yeah.
And then no sharps.
Well, and one thing, when you were pushing the needle down, if you noticed there was a slight click, so you thought it was done, right? So there's a really loud, discernible click, and in order to get it, you really have to push on the needle. And I find that actually helps because if you're giving an injection into somebody and pushing really hard and fast, you're aiming for that click, and then you know they've gotten the drug.
That makes sense.
Where if you're pushing slowly and all the other things, it's kind of an unsure. Yeah. I think I rushed by where to give the injection. So my favorite place would
You said
be
the butt.
the butt. There are also, you got it.
Thighs?
So, yes. Shoulder and thighs are the other 2 places. So about 3 fingers down from the shoulder is a muscle part of the arm where you can give the injection. It doesn't have to be perfect. It can be anywhere kind of in this area. You just don't want to hit bone, so you want to go down from the bone. And the thigh, if you break your thigh into 3 pieces, it would be the middle piece. So, yeah, you're not looking at closer to the pelvis. You're not looking at closer to the knee. You're looking at the middle chunk of your thigh. And again, you're just feeling for muscle is really where it needs to go. And those are the 3 main spots that hold a lot of muscle. And in the butt, it's the upper outer part of the butt. And so that's also easy to get at if somebody's sitting or lying down or anything. And you're kind of to the side. My experience with naloxone is people can wake up anywhere from 20 seconds after you give it to a few minutes.
Okay.
When they wake up, they're generally one of 2 feelings happening. One I've really noticed is embarrassment, because somebody doesn't realize they've overdosed, and all of a sudden there might be a scene happening around them, and so it's scary and embarrassing. And at that point, you just want to calm somebody and let them know, like, they're fine, they're safe, everything's okay, help is on the way. Another kind of emotion I've been faced with when somebody wakes up is aggression. And the reason that has to do with the fact that naloxone immediately puts somebody into withdrawal. So here's somebody who's getting high, who's thinking that they're feeling good, they go unconscious, they haven't realized they've overdosed, and instantly they're woken up with this feeling of withdrawal. That is a very disconcerting,
That would
You've literally ruined their high.
Yeah.
And so sometimes if I've seen somebody nodding off and they're semi-conscious, I'll say, like, I don't want to give you naloxone. I don't want to ruin your high, so you need to keep checking in with me. And I remember one guy in particular, I'm like, just tell me to fuck off. That's it. If you can tell, and he totally told me off. And I'm like, oh, okay, he's safe. Yeah, it's a great way to find out if somebody's safe.
Totally. That makes sense. One thing that you said, it can take a couple minutes, like a couple seconds or a couple minutes to work. What would you be looking at for administering a second dose? Them not coming to within how much time?
So I think generally they say between 2 to 4 minutes.
Okay.
I honestly will, depending on the situation, depending on response time of the ambulance, depending on where I'm working at the time, sometimes I'll give 1 every minute.
Okay.
And the reason is it doesn't hurt. However, by doing that, you're limiting the amount they're getting in their system, because you're kind of piling it up without giving it a chance to work.
Okay.
And the reason I might do it faster is because if I'm not getting a response and I'm by myself and I can't keep giving breaths without making sure the person's kind of up and about, I try and just get them conscious. And naloxone will get somebody on an opioid overdose conscious. Sometimes it can take upwards of 3 amps, though, unfortunately, and that has to do more with the amount in their system. So again, with things like a heroin overdose, it was unheard of to give 2 amps. It was always just 1 amp the person would come to, where now we're looking at 3, 4 amps before an ambulance gets there, and that's because we're looking at things like fentanyl and carfentanil, unfortunately. Is there anything else in this that you feel might be useful for you to know? Questions you have? Do you want to would you be willing to go through the acronym?
Yeah.
And just maybe try one more time to crack open naloxone and open the vantage point?
Okay, so it's save me. So stimulate first, breastbone, you said under the lips would be another, or the nail beds.
Yep.
Oh, that would hurt.
Yeah, it does.
And then clear the airway. So we've all seen it. Tilt the head back, make sure it's all straight and open, and start giving breaths. Check them out, make sure that they're not just sleeping.
Yeah.
And then prep the ampule. There's the one. Oh, there it is. You've got it. Little blue dot. Okay, so when I did it the last time, I found putting the blue dot away from myself was what I wanted to do. And that, like, clear and easy, as opposed to, like, pressing. And anyways, that's how I did it.
I like it. Yours is cleaner than mine, actually.
I also don't know that I
So
have any
I
of
put the
glass
blue dot
cases anywhere.
towards, so that's interesting to note because you put the blue dot away and it's a cleaner break.
Also, if you're breaking away from yourself, there are some shards of glass that came off of one of them. If you're breaking away from yourself, you're not pulling shards of glass towards yourself.
That's a really important point. And I think I learned that a long time ago. Actually, I think you are supposed to like really focus on breaking away.
It would make sense. This, one-handed, not the easiest thing in the world.
And it's taking longer than 5 seconds. So technically you want to be giving breaths. How you do that kind of just happens though. I don't have a trick for that.
No.
It's just you got to do it as fast as possible or try and hold it in your hand while giving breaths.
Yeah, that I can see being a little bit more of an issue to do.
Yeah.
But again, not something that's completely insurmountable.
Yeah.
Set it on the ground.
The goal is making sure somebody has air and making sure you get this into them.
Let's try not poking cat. Okay, so I'm gonna go harder this time.
There you go.
Hard click.
Yeah.
You
and
can
you
hear
can
it,
see
you can
it.
feel it, see it. There's a spring that's not sprung before the spring springs. You can see it. It's obvious. So we do that when we're evaluating and continuing to give breaths.
Yes. And so recovery position is where somebody's on their side. You know, you just want to essentially make sure that if they do vomit, they're not going to choke on it. So you want them on their side so vomit comes out of their mouth. So if they're breathing and if they're kind of semi-conscious, you don't want to give them more.
Yep.
You just want to make sure they're in recovery position and watch them until an ambulance comes. So you're just constantly reevaluating. You know, is the person continuing to breathe? Once they come to, are you offering some comfort or something so that, you know, they're not in such shock? Because,
Reassurance of some variety.
yeah.
Touch base.
It's scary. Yeah, to just all of a sudden be unconscious and then wake up and kind of all the stuff is happening. So because somebody doesn't necessarily know or remember that they've overdosed, you have to explain it. And that's also where you're going to bring in the conversation about like you need to not use for a couple hours. Try to get the person to stay with you until the ambulance comes. Sometimes people are going to be like, fuck you.
Okay.
That happens. But the goal is to try, right? Because the reality is if they use, and just reminding them, like if you get high right now, you're wasting your drugs because it's not going to work. So unfortunately, you're going to have to just feel this for a couple hours because it's not going to fix anything. As you've noticed here in front of us, we kind of have a mess happening. And unfortunately, this is something that can happen at the scene of an overdose. We have some broken glass. These are all things in first aid they tell you to watch out for. I think I've kneeled in broken glass before. It's not fun. So the goal again is to try and follow all the steps and be safe as possible. But the reality is when an OD happens, it's scary. And so the biggest takeaways I can give folks is make sure you're giving breaths, make sure that you give naloxone. And you're doing it in the shoulder, in the mid-thigh, or in the butt.
Now, one more thing that I've noticed in this kit is alcohol swabs. But when we were going through that demonstration, my idea is there's no time.
No, there isn't. Alcohol swabs, I mean, they're great to make sure something's clean if somebody has like a lot of dirt or something. But the reality is you can give naloxone through clothes. You don't want to spend time taking off somebody's clothes to then alcohol swab them.
No.
It's when we're talking a matter of life and death, an infection isn't that big of a deal. They can deal with that. There's medicine for that. So in the moment, I mean, it's a judgment call. If it's summer, somebody's wearing a tank top and, you know, you have other help available. Somebody might alcohol swab the area while you're giving breaths. I've had that happen maybe once. Oftentimes they do not get used.
Okay.
Yeah.
But low priority.
Yeah.
Okay, good. Good to know.
Yeah. Any other things that you kind of look at this or have gone through this and go, I don't know about, or...
No, except I need to go get a kit.
Yes.
Yeah, that's about
I use my kit, so maybe we can go get one together.
Yeah.
I will be going to AVI, it's Vancouver Island, to get a new kit. Normally I have training naloxone, which actually just has water in it. They don't come with the plastic caps, so I don't feel comfortable using them.
Yep.
And the reality is, these are close to expired, so I needed to get new ones
I noticed
anyways.
that.
Yeah. Always pay attention to expiry dates. That's really important. Yeah.
Thank you.
And again, when you're holding it, just remember to swirl. It's a habit. It's a good habit to get.
Okay.
Yeah. Thanks, folks.
Awesome.